So we're talking about autoimmunity this month. It's not normal to attack your own body. It's never normal. And I'm going to talk about MS today. I've had a lot of patients that I have found their MS actually. And the statistics for autoimmune is something like 11% of the population now. And that's just the ones that we know about. Most of the time, people don't even know they have these things going on, and they're just told they have all these weird symptoms, and it's just kind of live with it. But MS is one that's particularly difficult because it does attack the neuron, and it destroys what is called the myelin sheath. So it's called myelin basic protein antibody is the positive autoimmune attack. It is the symptom. It is actually not the issue. The real issue is that your immune system has lost the ability to tell self from non-self. And when we look at that, this is true for all autoimmune conditions. When you lose the ability to tell self from non-self, you have this accounting system. Your body kind of keeps track of what's going on. It should never have high levels of antibodies though. What happens is we have something called cross-reactivity is the most common reason for autoimmunity that comes secondary to a leaky gut. Trauma, illness, those are other triggers, but these are the main ones that we see are this chronic belly issues. We have low microbiome diversity, combine that with antibiotic use, whether it's overt antibiotics, I'm talking anytime in your life, or trace antibiotics that from meat and dairy, or even worse, the antibiotic-like effect of herbicides that we use, like Roundup. This is why you should always eat organic. Don't eat glyphosate-flavored foods. This causes the body to attack itself. And what our strategy is when we have an attack on our own body, especially with MS, we get those people into remission. Okay, I know it's a big statement. I'm gonna probably get in trouble for saying it. We get them into remission because we can take the body and lower the tide, which lowers the tide for all the boats, right? So if all the boats are different systems of your body and the tide is inflammation, you wanna lower the tide. You don't wanna lift the boat out of the water, right? And when you do that, you take the strain off the system, you heal the microbiome, you make it diverse and populated with good bacteria, you inhibit bad growth, you put in the nutrients that you need and the anti-inflammatories that you need, get the blood sugar regulated, make sure the detoxification system is good and the hormones are balanced, make sure that the nutrient levels are present and the mitochondria can make energy, etc. When you do all these fundamentals of functional medicine that we do, customized to every single patient, the body can heal and stop attacking itself. And when it does that, we call that remission. It doesn't mean that you're never going to have flare-ups, but you're going to hopefully know what to do for that. So if you or anybody you know is suffering from MS and doesn't want to go with the immunosuppressive route, and they want to really actually generate being healthy and being in remission, right, then functional medicine is the way to go with that, right? So I hope that's helpful. All right, bye.